and I welcome everyone officially to this webinar on our title, Beyond the Seat at the Table and More Than a Checkbox, a multi-stakeholder dialogue on youth engagement in NCD prevention. And I'm going to give the floor to Urška. Urška, please feel free to go ahead.
Thank you. Thank you for this lovely introduction. And welcome everyone, and thank you for joining us today. We often hear that young people should have a seat at the table, and today's discussion, we would like to also go one step further, so to see what happens when after this seat is offered, and how to just move from the presence to actual influence of young people, to move from consultations to co-ownership or co-creation, and to move just from some project-based consultations to more lasting structures. As you have heard, our title today is Beyond the Seat at the Table and More Than a Checkbox, which implies that the participation alone is not enough. And the real challenge is whether young people can actually shape agendas, decisions, and outcomes. As you have also heard, that today's webinar is part of the youth chapter on NCD prevention and the youth health policy platform thematic network, which was one of the 3 chosen thematic networks. It's coordinated by our National Institute of Public Health in Slovenia, and it's also taking place inside the Joint Action Prevent NCD. The goal of the network is not simply to just discuss youth engagement. We want to explore how young people can meaningfully contribute to shaping policies, programs, healthier communities. And throughout today's webinar, we will hear different examples from European institutions, youth networks, civil society, researchers, policymakers, and together all this will help us inform also the joint statement that the thematic network is currently developing. And it's my pleasure to start first with the European perspective, and to help us better understand what are the recent developments at the EU level. I would like to welcome Carlos García from DG SANTE. Carlos will now share with us some updates on the youth engagement initiatives and reflections on the future directions. The floor is yours.
Thank you, Urška, and thank you, Urška, Elena, on all the partners for organizing this dialogue on youth engagement in non-communicable diseases. First of all, I'm Carlos Mayoral, working Director General of SANTE in the unit of B4 in health promotion and disease prevention. So we mostly work on non-communicable diseases. We are right now focused on the Commission priorities of mental health and cardiovascular disease. I want to give first an overview of the non-communicable diseases. As you know, they remain one of the greatest health challenges in Europe, and they are responsible for 80% of the disease burden in the EU, and therefore have a significant impact on people's life, health systems, and our economies. And this is why tackling NCDs remain a key priority for the European Commission. Through the Healthier Together initiative, we support the member states in addressing 5 key areas: health determinants, cardiovascular diseases, diabetes, chronic respiratory diseases, and mental health and neurological disorders. A strong focus across all these strands is in reducing health inequalities and promoting a more coordinated approach to prevention, early detection, care, and quality of life. As I mentioned more recently, we have also launched the Safe Hearts Plan. We are addressing in this way the #1 killer in the EU, which are cardiovascular diseases. And the plan aims to strengthen prevention, early detection, treatment, and care, including rehabilitation. We have seen that meaningful youth participation can strengthen the design and impact of prevention policies, and therefore youth engagement is becoming, as you see in this kind of activities, increasingly important element of our work. through the Joint Action Prevent NCD, the Youth Advisory Group, which is also organizing this session, is already helping ensure that prevention activities reflect young people's perspectives and priorities. This year, we also engage directly with young people on cardiovascular health. And in September 2025, we organized a dedicated discussion on cardiovascular health. During this year, European Youth Week, we held a Safe Hearts Plan session in the European Parliament, where young people share their views on cardiovascular health checks, prevention, and screening. In addition, we are pleased that this year's thematic network topic, which provides an important and timely space for dialogue and collaboration on NCD prevention. Looking ahead on the process of the work of this network, I would encourage this network to consider how its work can contribute not only to broader NCD prevention efforts, but also to cardiovascular health and the objectives of the Safe Hearts Plan. At the same time, I wanted to encourage you today to think beyond recommendations alone. The value of this output of this initiative, the joint statement, it will depend on what follow afterwards, we should therefore focus on identifying concrete actions that youth organizations, public health authorities, researchers, and stakeholders can implement together, and how to sustain this network and this collaboration beyond the current process. Therefore, I think the impact of this the output of these activities can have a really impact in policy, and building lasting partnerships and strengthening health literacy and creating opportunities for young people to contribute to policy development and implementation will be essential if we want meaningful and lasting impact. I don't want to take more time from today, because it's on you now to propose further action. So I wish you a productive discussion, and thank you very much for your participation.
Thank you, Carlos. Yeah, we have heard how youth engagement is also gaining more visibility at the EU level, and also how they're creating new opportunities for participation. But yeah, moving a bit forward to the next speaker, we can say that, on one side, also participation requires spaces where young people can develop skills, where they can network, where they can gain some confidence. And saying that, it's my pleasure to introduce Lucia Linares from the European Health Forum Gastein, when she will present more about the Young Forum Gastein. Lucia, the word and floor is yours.
Thank you very much. So as Urška said, my name is Lucia, and I'm responsible for the Young Forum Gastein initiative at the European Health Forum de Gastein. And as it says in the subtitle, I'll be talking about how Young Forum Gastein empowers young voices in European health policy. So just to give a kind of very brief background or history to the initiative, it was kickstarted in 2007 by the European Health Forum Gastein and the European Commission at the time, DG SANTE, with the aim to bring young health professionals to the annual health policy conference organized by the European Health Forum Gastein, and thereby connect policy officers and researchers. Today, the network has grown into a multi-stakeholder, peer-to-peer capacity and skills building program, and has over 700 alumni working across this health sector in the wider European region. But who are these young professionals? This is just a snapshot of this year's cohort, but they are under 35, early to mid-career professionals working across the health sector, such as in ministries of health, civil society organizations, research institutes, also in the private sector, or also as clinicians. This year, we're welcoming 63 scholars to the forum, representing 32 countries globally, and that are working in 23 countries within the wider WHO European region. So how does Young Forum Gastein, how does this program sort of empower these young professionals? Well, firstly, we make them active participants in the forum. They're given the opportunity to hone their skills through interviewing speakers, writing up session outcomes, which feed into the outcome report. which is a publication, preparing social media posts, reporting from sessions, and as moderators, speakers, and facilitators in various workshops. Scholars also build capacity at the forum by engaging in a tailored program of interactive workshops, law clinics, presentations, in a mentoring program with speakers that attend the conference, and in dedicated Q&A sessions with leading experts. But also beyond the forum, the European Health Forum Gastein ensures that young Gasteiners remain part of its community and participate in other EHFG projects and activities. So some examples is that we have young Gasteiners on our board. Young Gasteiners are also given the opportunity to join a task force where they take on an active role in shaping the conference and the YFG program. They're invited back to the forum as speakers, moderators, and facilitators, and they take part in other EHFG projects that we run, such as the European Health Union Initiative and the Public Health Diplomacy Initiative. And finally, the European Health Forum Gastein brings together young professionals working across a multitude of kind of health policy, broader public health topics. But I wanted to highlight one recent example of youth participation in NCDs. Last year at the forum, the Austrian National Institute of Public Health organized a session on tackling NCDs in Europe. The session ensured that young voices were meaningfully included. And to this end, a former young Gasteiner and senior health expert at the Austrian National Public Health Institute moderated the session, and a keynote was delivered by the president of the International Youth Health Organization. In addition, young Gasteiners were assigned to the session to help stimulate dialogue. They acted as interlocutors, encouraging and capturing the discussion along the walk. So that's all for me on youth networks and specifically Young Forum Gastein, but I'll be moderating one of the breakout groups, so I look forward to further discussions on how we can ensure that we meaningfully engage youth in health policy.
Thank you, Lucia. Yeah, just to say that you are also very time efficient, so we have also time if any one of you would like to raise your hand or maybe post any questions in the chat directly to Lucia. And while you're thinking about the question, I can also recommend myself the program. I've been part of it for many years, and it was a great contribution to also the professional development. Yeah, maybe while waiting, because your also presentation reminds us that meaningful engagement does not happen automatically, that you need some kind of a structure, and it also requires investment and commitment from the current leaders to open these spaces and create opportunities for young people to take active roles. As you mentioned, they have many active roles during the forum itself. Currently, I don't see any questions, but perhaps some are still thinking, and maybe we'll write some questions, and perhaps at the end we still can open again this opportunity for some more questions and discussion. And as you mentioned, there will also opportunity in the breakout rooms to maybe exchange some more information. And with that, I would then move to our next example that will show us what can happen also when those opportunities then translate into advocacy and influence. I would like to now welcome Karen from International Diabetes Federation, the European region, who will share us their experience of the Euro Network and Youth Advocacy Committee, demonstrating how youth-led advocacy then can contribute directly to policy discussions and decision-making. Cameron, the floor is yours.
Thanks so much, Urška. Thanks for the introduction. So as Urška said, my name is Cameron Keekern. I'm a project worker and youth advocacy coordinator with the International Diabetes Federation for Europe. And I'm going to talk through in the next few minutes a couple of examples of how we involve young people and youth leadership in the advocacy and policy work that we do at IDF Europe. So to start off, to give a bit of a background, I wanted to talk about the Euro network. This is our youth alumni network, of which we have close to 300 young people across both EU and non-EU countries. It was established in 2011, and it's empowered young diabetes advocates as key drivers of meaningful change. And at its heart, it's a pan-European community of young people with lived experience of diabetes. A lot of this experience will be of type 1 diabetes, but any experience of diabetes is relevant for this particular network. And the vision of this, I suppose, alumni youth network is to have a strong European span of young diabetes advocates working together towards better lives for people with diabetes, and to cultivate a community that connects and develops people together, their experiences, and broad connections across Europe itself. And we measure that impact, I suppose, in terms of ensuring that young people and their voices and their stories with diabetes are included in policy, education, research, and ensuring that we keep it high on the diabetes high on the political agenda. So our Euro network would be involved in several initiatives with us, both at a local and at a European level, where we interact with MEPs, the Commission, different policy institutions to ensure that their voices are heard in those conversations around health, and their stories with diabetes are listened to make, as I said, their lives better. When we look at the program of activities that the Euro network does, I suppose we split this into kind of four regions or four areas. The first here, we have our Youth Leadership Lab, which will take place again next month in Évora in Portugal, where we'll have 20 new young people who will come along for that Youth Leadership Empowerment Camp for 1 week of an immersive, I've said here, immersive 5-day camp where new advocates can become Euro members, where we look at building empowerment, community connection, and also giving them an opportunity to work at a European level advocacy project. As I said, it's hosted annually, and this will be our 15th iteration of the camp happening this year in Portugal. And it's one of the main events of how we can get new young people involved in the work that we're doing and provide opportunities to young people across Europe, both, again, EU and non-EU, to get involved in a intensive, I would say, camp, but in a space where they can come together with others with similar lived experience to them to shape what advocacy could look like in the future. Alongside this, and coming out of that Youth Leadership Lab, we also have our mentorship program. This started as an initiative within the actual lab itself to provide peer mentors to the young people who are in these camps and in these programs with us. But actually, overall, we can see that there's a momentum for this mentorship program in a more broad-reaching way of the youth activities that we do. And we see this as a way of creating sustainability in our youth advocacy networks, by providing, one-to-one peer support to young people living with diabetes from young people living with diabetes as well, but also as a way for people who may age out of programs, who have been involved with us for a number of years, to give back different skills and to be part of creating that intergenerational network of young people who are looking at creating advocacy projects or doing advocacy at a European level. The third program that we look at is our Euro Forum. So this is an annual alumni event where we bring people together in the October time of the year. And this is more concentrated as a learning hub where we share knowledge, where we might collaborate with other stakeholders, other organizations, and we plan future advocacy initiatives. This might be something that's much broader than the smaller advocacy projects that they might work on at the camp themselves. And it's often co-organized, as said, by IDF Europe, but also by alumni who are getting involved, who might have been a senior leader within the camp, maybe part of the mentorship program, or maybe have taken part in other projects with us. Although I'm talking here today about some of these very distinct projects, a lot of the work that we do at IDF Europe includes the voices of young people, whether that's a conversation or event that we're having at the Parliament to projects that we're part of. We try to include youth voices in every possible way that we can. And the fourth thing, and this is a new initiative that we've set up in the last year and a half within IDF Europe, and that's our Youth Advocacy Committee. And this is bringing young advocates together directly into EU level policy engagement. And this is young people who've said to us, I want to get more involved in policy, I want to get more involved in EU level advocacy, and I want to build my skills within that. And so this allows us to connect lived experience with European institutions and policymakers, which I'll describe on the next slide here. So as I said, this is a new initiative that we set up in the last 18 months. We've known from a lot of the research that's coming out and conversations we're having in the space that young people, the voice of young people is gaining increasing importance within many European institutions. And as I said, members of our Euro network expressed a desire to deepen their expertise at this level and understand how exactly European advocacy works and how they might be able to influence it and how they might be able to work together. So our Youth Advocacy Committee, what does it do? We bring together, as I said, young advocates with lived experience who are eager to enhance that EU level policy expertise. We engage with policymakers and other key stakeholders and consultations to drive meaningful change. For example, there's the consultation open at the minute for the youth strategy post 2027. We're engaging with our young people on what they might want to see from a diabetes perspective to be included in that. We've also engaged in youth policy dialogues, which I'll talk about on a future slide. And we look at, providing ways for them to give feedback on the work that IDF Europe is doing as well, making sure that our policy files and our position papers, for example, are inclusive of both their experiences and their priorities. And ultimately, what we're trying to do is amplify their voice within the work that we're doing. We do this through policy newsletter, online meetings throughout the year. We give them information and kind of onboarding guides for the EU institutions and policymaking processes. We invite them to join us on meetings with MEPs that are relevant to their nationality and to their priorities. And we also look at how we might build networks, collaboration and partnerships. So we also aim to partner with other youth organisations to work together on some of the policy files at the European level, including the Joint Action to Prevent NCD Youth Advisory Group, and also the WHO Regional Council Youth Representation, and how you might feed into those particular works. But for the purpose of this, I wanted to talk about two distinct actions that we've done, or two distinct things that we've done with our young people as seeing advocacy in action here. First, last year in July, we had a youth policy dialogue specifically on diabetes, where we brought 9 of our Euro members together for a roundtable discussion with the Commissioner for Intergeneral Affairs, Youth, Culture and Sport, the Commissioner for Health and Animal Welfare, and also a Maltese MEP, Peter Agius, who sits on the IDF Europe Mobilising for Diabetes MMD interest group. And in this conversation, these young people were able to express their desires for what they would like to see Europe do to support them living with diabetes across their life cycle. So looking at things like, how do we meaningfully engage with people with lived experience? How do we reflect that in policies? How do we reduce inequalities to access to diabetes care? And how did that feature in the lives of the 9 young people that we brought? Very, very strongly came through psychological and mental health supports for people living with diabetes. I think that's translatable across many NCDs, not just diabetes. Raising awareness in schools and the general public of living with diabetes, and removing barriers to sports and physical activity. So these are the topics that were important to these young people that they were able to share directly with policymakers as they were looking forward to what's the new mandate within the European Commission, and what's the new, I suppose, the new mandate within the MEPs and within the Parliament as well, and looking at any policy files that might be coming up, that they've been able to share their lived experience with that. Going back a second for the psychological support and mental health, this was something that was really strongly picked up by the Commissioner for Intergenerational Fairness, Glenn McAuliffe, and also MEP Peter Agius, so much so that it became an event that we co-organised as the Youth Advocacy Committee, the Euro Network, IDF Europe, and those 2 offices, where we did an event called the Sound of Diabetes. You can see the 2 QR codes here, which takes you to a report of the event and also a video that we did. But this was a youth-led event on mental health for World Diabetes Day this past November, the 12th of November 2025. And this was about sharing from the young person's perspective, what are the impacts of living with diabetes on their mental and psychological health, and what are the things that they would like to see policymakers and EU institutions do to improve that. Just talking about things like the psychological burden of type 1 diabetes in this case, the stigma and isolation that some young people face, the access gap for mental health supports, the policy gap on acknowledging the impact of living with an NCD, in this case diabetes, on both your mental and physical health, and looking at how do we include lived experience as we have these conversations. And so we were able to bring 20 plus young people into the European Parliament, where 6 of them talked about their experiences of diabetes and mental health, and gave some concrete examples of what they would like to see policies and EU institutions do to improve that. And this has led to us within the Youth Advocacy Committee also looking at doing this on an annual basis. So we have our next youth-led event, which will be in October in 2026, again leading up to this year's World Diabetes Day in the European Parliament. So I think I'm a little bit over time, maybe a minute or so. So I wanted to maybe just finish on this slide here about how you might be able to get involved and stay connected. And there's many ways to engage with us. If you're a young person who lives with diabetes or has experience of diabetes, you can apply for our camp for next year in 2027. You could also reach out and get in touch about a youth advocacy committee, or get in touch with us about ways that we might be able to partner together. If you're an EU institution or another youth organization, getting involved with us for our youth forum, being able to collaborate with us on delivering sessions or exploring potential connections that we might have. And also the same for our youth advocacy committee. How can we connect together on common policy files or to explore potential collaborations? You'll see some of the social media handles there that you can use to amplify the voices of young people with diabetes, and also my email address is there as well if there's any other questions. So I think that is all from me. So Urška, I might hand back over to yourself.
Thank you, Cameron, for a very rich presentation. We have heard many great examples of how you enable this support, leadership development, advocacy, youth-led advocacy. Taking into account the time, and I don't see any current questions or raised hands, I would then hand over to Anna Osana and Patricia Tolman. I'm very pleased to welcome both of them. They will present the Place Standard tool for youth and share how young people can be involved in creating healthier communities. And yes, giving the floor to both of you.
Okay, thank you, Urška. So, hello everyone, and thank you for joining us today. My name is Ana Ocaña, and I'm a researcher at FISABIO, the Public Health Research Foundation of the Valencian community in Spain. And together with my colleague Patricia Tolman from Bochum University of Applied Sciences in Germany, we are going to share with you the work we've been doing around the Place Standard tool for youth. That is a participatory tool designed to give young people a real voice in shaping the place where they live. And within an Erasmus Plus project, we are leading the work packages on the translation and adaptation of the tool. This is originally of Scotland, and as well as the evaluation of the process in collaboration with colleagues from other 5 more European countries. So, as we all know, our health is shaped by the circumstances in which we are born, grow up, live, work, and age, and the neighborhood you grow up in, the streets, the green spaces, the sense of safety, the feeling that your option matters. All of this profoundly influences health and well-being. And internationally, there is a growing recognition that we need to create healthier and more sustainable living environments, specifically for young people. And this cannot happen without young people themselves. So it is essential that the key are not just consulted, but genuinely involved as active participants in shaping the place where they live. Because participation itself, of course, is being heard, being taken seriously, having real influence on, is a health promoting experience in its own right. So, and how we do this in practice. So this is where the Place Standard tool for youth comes in. It is a structured conversation tool that helps young people assess the quality of their local environment across 14 dimensions, and covering everything from physical spaces and movement to social connections, economic conditions, and their sense of influence over that what happens around them. It's used in facilitated group discussions in schools, health centers, community organizations, universities, and the results are designed to feed directly into local planning and policy processes. But why a youth-specific version? Because young people experience their environment very differently from adults, and a tool adapted to their language, their concerns, and their way of engaging is essential if we want meaningful participation or not just token consultation. And meaningful participation builds civic agency, health literacy, and ultimately more equitable communities. So let me share an example that is especially close to my heart. Following the extreme weather events that devastated part of my region in Spain in October of 2024, we brought the Place Standard for Youth into a secondary school in one of the affected municipalities as a part of the process of developing the local reconstruction roadmap. We asked young people, how do you see your place? What needs to change? How do we rebuild it to improve what we have and protect ourselves for future emergencies? So in this diagram, you can see what young people rated highest and lowest in their municipality. And in the box alongside, you can see how we analyze those results, identifying key topics and concrete proposals for improvement. Because the tool is an action oriented, this is really important. This is the most meaningful of the tool. It doesn't stop at describing problems, it moves towards solutions. So one finding, as you see here, is student design, especially striking a way. Young people express a strong sense that they lacked the capacity to participate, that they were not being taken into account in the reconstruction of their own community. And after everything they have been through, their voices were not at the table. So is that if it is that's not a reason to start, it's a reason to do this. So then Patricia will now take you through another example from Germany.
Yeah, of course. So yeah, there's another example that we did in Germany, or colleagues of me did in Germany, during the pilot testing of the PST for Youth tool. So they engaged young people aged from 10 to 16 with lower socioeconomic background, and used, for example, incentives like ice cream vouchers to boost participation. Then they came to this youth center where they pilot tested the Play Standard Tool for Youth tool, and they were using a little bit different than in the example that Anna just told us, but they used a one-on-one or one-on-two method to discuss their surroundings, their places, and these discussions were facilitated by youth workers. Based on the results, the discussions between the youth will be led to political stakeholders, so that the youth can get into discussions with the political stakeholders. And it is also important to acknowledge that that managing expectations of meaningful participation is crucial, because it takes time to change structures, and this helps to prevent frustration if you communicate it early on in the stage. We've also done an evaluation. So these results were generated by a separate questionnaire that was filled out by the participants, by the young people in all of our 7 countries for evaluation purposes. And some of these results are that the young people say that they didn't have problems filling out the PST for Youth, and they were able to express everything they wanted to say about their place. But some of the participating young people feel that they are not taken seriously when getting involved in their place. And this is why it is so important that if we engage young people, actions and improvements result. Furthermore, the last diagram, I see that it's shifted a little bit, but the last diagram shows that by using the PST for Youth, we were able to reach a lot of young people who haven't been participating in their place before. So this shows that a lot of them disagree on this. So they have not been involved yet, but by using this tool, yeah, they were able to participate for the first time. So we also do have a lot of materials that we developed in this project. So there are currently 7 handbooks for the Play Standard Tool for Youth in 7 languages, and also 7 booklets like for the young people to fill them out. We also do have a website. You can find a QR code here. Yeah, and our last message for you is that if someone is going to shape your community, why not you? Thank you very much for listening. If there is anything, feel free to contact us.
Thank you, Anna and Patricia. Very nice presentation. Yeah, we have seen what youth engagement can also look like in creating our surroundings and priorities in our how priorities are shaped in our everyday environments. And yeah, maybe I see we already have some interesting questions, but they are spread around different speakers. So I would maybe go to our last presentation and then have a few minutes for some joint questions. Our final presentation brings us back to the question of some governance and policy making. And saying that, I would like to welcome Ida Stepišnik from the Ministry of Health from Slovenia, who will share some reflections how meaningful youth participation in health governance looks like. Ida, the floor is yours. Maybe.
Thank you. I hope you can still, is the presentation?
Yes, it looks like you stopped sharing the presentation.
Oh,
don't worry.
I am sorry.
No problem at all. Just give me a second and we'll go to your presentation in a second. Okay, here we are.
Perfect, thank you so much.
No problem.
So hi, good afternoon, everyone. So my name is Ida Stepišnik and I work at the Office for Cooperation with the World Health Organization, Ministry of Health in Slovenia. So let me just, maybe some things that I will say, maybe you've heard it before, but let me just remind you again of the important messages that were already shared. So first of all, the title of today's webinar, so beyond the seat at the table, so more than a checkbox, it really encounters what we have, many of us have encountered. So really, over the past decade, there has been a significant progress in youth engagement and many more consultations taking place than before. And so many youth representatives were invited or are already invited to to different meetings, and more organizations are being recognized because of this. Yet many young people still have a participation process asking the same question. So did anything actually change here? So I think this is the core kind of like difference between participation and meaningful participation. So meaningful participation is not defined by whether young people are present in the room. It's defined by whether their participation influences decisions. So today I would like to share some of my observations from my experience moving between youth organization, national policy making, and global health governance. So the first observation is that meaningful participation starts before consultation takes place. So many participation processes begin when a draft strategy, action plan, or policy is already largely developed, and stakeholders are then invited to comment on the document whose main direction has effectively been decided. So consultation is important, but meaningful participation starts earlier. So it starts when young people can actually help it identify priorities, frame problems, and shape the agenda itself. And one positive example from Slovenia has been increasing involvement of civil society organizations in preparation of strategic health documents, including consultation on the public health strategy. And these processes recognize that organizations working directly with communities often identify emerging challenges before institutions do. So the lesson here is simple, that if participation only begins once solutions have been drafted, its influence will be limited. My second observation is that the meaningful participation is strongest when young people move from advising role to contributing role. And there is a good example from tobacco control. So for many years, Slovenian youth have played an active role in advocating for stronger tobacco policies, raising awareness among peers, and contributing to public support for evidence-based measures. But what I find really interesting here is that young people have also been involved in the implementation. Organizations such as No Excuse Slovenia demonstrated that young people can be effective advocates, not despite their age, but because of it. Their credibility among peers allowed them to communicate public health messages in ways that institutions could never. Under Slovenian legislation, minors over the age of 13 can participate in inspections aimed at detecting illegal sales of tobacco products to minors. Through supervised mystery shopping inspections, young people can help identify violations and support enforcement efforts. In other words, young people are not only consulted about tobacco policy, they help make that policy work. This may seem like a small distinction, but it really fundamentally changes the relationship between institutions and young people. Young people are not only viewed as solely as benefactors of health policies, they become partners in achieving health objectives. And perhaps one of the most underused forms of participation is the involving of young people, not only in designing policies, but also in implementing, monitoring, and evaluating them. So my third observation is that the meaningful participation requires institutions, not just enthusiastic individuals. Many successful examples of youth engagement begin because a particular policymaker, civil servant, or advocate believes in participation. But what happens when this person changes jobs? If participation depends entirely on individual champions, it remains fragile. This is why institutional mechanisms matter. At the national level, we have seen efforts to strengthen cooperation between public health institutions and civil society through dedicated structures, including the establishing of the NGO service at the National Institute of Public Health. I think by now, I don't think I should call it the NGO service anymore, but perhaps Urška can advise on how to approach this later. So, and another important thing about institutional mechanisms is funding. In Slovenia, long-term funding of youth organizations are done both by the Ministry of Health and Ministry of Interior and Public Administration. Also, regional and local opportunities are also there. And they really ensure operational continuity and strengthened youth participation in Slovenia over the long term. Sorry. And at the global level, we're still seeing actually a similar trend. The Youth Council was created not simply to organize conversations with young people, but to establish an ongoing mechanisms of engagement between WHO and youth-led organization. Likewise, the World Health Assembly's resolution on social participation, adopted in 2024, really reflects growing recognition that participation should be embedded in governance system rather than treated as an occasional activity. For me, these developments point to a broader shift. The question is no longer whether young people should participate. The question is how institutions can create conditions for participation, and that is continuous, influential, and accountable. As we move into the discussion, I would leave you with 3 practical questions that can help you distinguish meaningful participation from the tokenistical one. So first, were young people involved before key decisions were made? Second, did they influence the outcome in a visible way? And third, would participation continue if the individuals currently driving it were no longer there? If the answer is yes to all of these 3 questions, we are probably moving beyond the checkbox. If not, then perhaps our task is not to create more opportunities for participation, but better ones. Thank you.
Thank you, Ida, for a very thoughtful finish as well, that can help us guide us also through the breakout rooms. And now I think we can dedicate a few more minutes to some questions that have popped up during very interesting presentations. And to guide us through the questions, I would ask my colleague, García, from our service, still currently called a service for NGOs, but yeah, we're transitioning to a service for social participation in autumn. So yeah, thank you for also pointing that out. Katja, show us the way through the questions.
Hi, everyone, also from my side. So I have noted a couple of questions that have been added to the chat. So I will go through those first. But in the meantime, if the participants have any other questions they would like to towards the panelists, feel free to use the raise hand function that is in the app of WebEx itself, or you can simply drop the question in the chat box and I will read it out loud as well. So the first question, I believe, goes towards Lucia about the Youth Forum Gestein and comes from Dr. Mahdi, the director of Athena Center for Advanced Research in Healthcare. They're asking that from their work in primary care and digital health research, including a recent study on patient-reported outcomes in semi-rural communities, they've observed that young people with NCDs often face a double barrier that includes limited health literacy and fragmented digital access. So how does the forum see the role of digital health tools in amplifying youth voice in NCD policy, particularly in underserved or rural European settings? Lucia, feel free to answer. And also if there's any other panelists who would like to add on, you're welcome to.
So I'm not sure I'm particularly so best placed to answer this question, just because, as I said, the European Health Forum Gestein brings together health professionals from a variety of topics and covers a variety of topics. And so specifically, the session that I mentioned on NCDs was one of many. And that one wasn't kind of too actually, Katja, I think, Urška was maybe in that session. I'm not sure whether it really kind of covered this exactly, but certainly these topics of kind of digital health tools, the importance basically of kind of amplifying youth voices on using these tools and in health health policy more generally is kind of a focus of the forum. And again, just to say, I mean, we really, the whole idea behind Young Forum Gestein is really ensuring that young people not only kind of are able to come to the conference, so it's a fully funded scholarship, also enabling youth from maybe more underprivileged backgrounds to attend the conference. But it also ensures that that these kind of young voices do also form part of sessions and discussions. So the case that I gave of this one session on NCDs, where we had another number of panelists that were actually young professionals speaking there. We do actually also have this news desk feature in each of our sessions, which is also filled by young Gesteiners who basically actively contribute to the discussion and can provide reflections on the various topics. So I'm sorry that I couldn't give a kind of more detailed response to that. Maybe someone else can sort of jump in with more kind of the topic expertise there. But yeah, I hope that I have provided some kind of more clarity on what kind of Young Forum Gestein does to kind of also support youth from various backgrounds.
Thank you, Lucia. Just wanted to quickly check in if any other panelists would like to provide a quick response before we move on to the next question, specifically about the digital health literacy and tools.
I can maybe just add that the whole forum is also you're able to view the whole forum in a hybrid format, meaning that like anyone is free to watch any of the sessions that are covered virtually. Also, like if you're not able to be there, being there, kind of to provide also more accessibility to those who are not able to get there in person.
Okay, then let's move on to the next question, which was provided by Mehitabil from the Young Hearts Initiative. And this question was towards Cameron. I know, Cameron, you've already answered in the chat, but feel free to provide some extra details. The question was, what are your best practices for maintaining a healthy balance between the level of engagement expected or hoped for from young advocates and the realities of their personal lives, health-related challenges, and other commitments? And then in her experience coordinating a youth group, the young patients are often highly motivated and eager to get involved, but at the same time, they're managing complex health conditions, fatigue, education, careers, and other responsibilities that can be limiting to their time and energy able to spend. So yeah, the floor is yours.
Yeah, after that, maybe I'll just expand on what I put into the chat, but I think the overarching thing here is that flexibility is the most important thing. And flexibility in multiple ways. It's about redefining sometimes as large institutions when and how you work. So moving from, okay, it's Monday to Friday, 9 to 5 business hours, and actually looking at how do we leverage meeting people where they're at. So I think that the flexibility and the types of engagement that you're looking for. You may not necessarily need everyone to be as engaged as the other person in the room, but providing a space for people to provide, asynchronous feedback via email or Word documents, having an opportunity for people maybe to meet with you one-to-one or in smaller groups. As I said, having group sessions, offering kind of spaces where people might be able to catch up with you at a separate time. I think it's also about understanding what we're expecting of young people. And I think sometimes and I think back to kind of some of the early experiences I had as a young person getting involved in things. You often had this kind of perception of I have to be really polished, or I have to have a really concrete point, or have this really well thought out and well laid out argument for why I think something should happen. And I think that we need to kind of flip that narrative on its head a little bit, of having conversations where people are able to just talk about their experiences, their lived experience of living with, in our case, diabetes, maybe living with another NCD, maybe living through a political system, and so on and so forth. I think when we move to this idea of conversations, building together, sometimes a little bit more messy work than we're used to. We're not looking for, a polished 10-page document. We're actually just looking for how are we kind of going to work through these conversation points together and come up with something, and debate and dialogue ideas back and forth. I think that's really important. And then I think also not underestimating, the types of people that might be in the room. I said this in the message here, being the loudest or the quietest person in the room. Both of those personalities bring lots of different dimensions to a conversation. So ensuring that you don't, as a person who's organizing a youth space, favor one of those over the other and only take on points from the loudest people in the room, or only take on points from people who've emailed you in beforehand or have sent you a document. So it's really, I know it's kind of all talking about flexibility, but it is about changing that kind of very strict sometimes process we have for getting feedback in our day-to-day professional life, and looking at how do we organically create systems where people want to come and have conversations with us. Ultimately, if we create a space where people can show up how and when they can and in a way that's comfortable for them, we ultimately get better feedback and better engagement and better co-creation, rather than expecting someone to give us feedback or give us work, or work with us on something in a way that's not very convenient or reliable within their lives. And then it's also about managing everyone's expectations. What do they want to get out of it? What are you hoping to get out of it? How do you meet in the middle? And being really clear about what it is you're asking for feedback on, or what you're asking for people to help with, I think is really important. I think we could have a whole webinar essentially on how we engage young people correctly, but I think it is about moving away from the traditional kind of professional models we've seen, organic, built up conversations, flexibility, and allowing people to come to you as they are, and meeting people in space that they're comfortable. The only other point that I would add, and it's kind of tagging onto another question here, and it was about the diversity piece. I think sometimes we look at young people in general and we say, oh, they're hard to reach groups, so we can't engage with them so well. When you look at diversity through that lens as well, you have a double layer of this kind of myth of people are hard to reach. And I think that we have to take a really good look at what practices are we doing in youth organizations to go out into populations that are underserved? How are we getting those marginalized voices? How are we engaging with them? How are we telling them about the opportunities? How are we ensuring and not accepting that we don't have diversity, but we'll keep going? How do we remove that as the status quo from the conversations that we're having? And I think as we're having those conversations, we actually build much more flexibility into youth engagement in general.
Thanks, Cameron. I couldn't agree more. And it's also very important to highlight that not all young people are also looking into becoming activists, the same way that not all of us will be doctors, policemen, marine biologists, or bake cakes for a living. Some young people are just looking for a platform that can provide them with support and a community rather than somewhere where they can engage and be an activist. So it's also important to kind of highlight that part. Now, we do have several other questions in the chat, but we have some discussion also planned for after the breakout discussions. But there are a couple of important notions that have been added, for example, from Filmon, who's discussing about the underrepresented groups of young people, specifically youth with disabilities, migrant low-income backgrounds, rural areas, and so on, that are structurally excluded often from these processes that are meant to include youth. And I think this is exactly what we will be discussing now in the next part of the program, which are the interactive breakout discussions. So I'll leave the floor back to Urška for the instructions, but please keep these questions in mind because we will try to tackle them together, as they are something that we are very keen to include in the joint statement so that it is shaped in a way that is able to represent as many youth and subgroups of youth as possible. Urška, back to you.
Thank you, García. Yes, going to the breakout discussions, the breakout rooms, I would like to thank our presenters who have also kindly agreed to moderate these breakout rooms. So we'll have 6 breakout rooms moderated by Ida, one together with Anna and Patricia, one with Cameron, one with Lucia, and one with García, and then the last one with me. They will last for 15 minutes. Please introduce yourself briefly in the groups and discuss the following 2 questions. One is focused more on the barriers and enablers of meaningful youth participation in preventing NCDs. And the second question, what can we do to strengthen and improve youth participation? I would also add one more important note that this discussion should focus more on the actions that ourselves, like NGOs, wherever you're seated, what we can develop and do ourselves, not so much directed into what member states, our decision makers or EU should do, just to kind of also set the debate, not to lead to any perhaps too big expectations that we're setting what others should do. And then after the breakout sessions, we will reconvene again for the 15 minutes of plenary discussion, and you will be invited to report back either through your moderator or maybe a reporter that you will agree upon within the group. And with that, I hope everything is also technically ready for us to kickstart the breakout rooms.
Thank you, Urška. Thank you for that. I'll start the breakout sessions now, everybody. Just be patient. It may take a few seconds for you to be redirected to the breakout session.
So again, it's a circle with a lot of kind of like loops in between each other. But I see that we have now been joined by the rest of the groups. So I'll give the floor back to Urška.
Thank you, García, and thank you all for contributing, and our moderators for leading this process. We may have some technical kind of challenges in the beginning to see where the participants went, and maybe some challenges with the video connections, but I think everything is now good, and I think it was successful, the discussions in the breakout rooms. I would like not to lose too much time to also hear some key takeaways from each of the group that has discussed. So I would first give the word to, I think the group 2 was very active also. So let's hear from our group 2 from Anna and Patricia.
Yeah, thank you. We had great discussions and we could have discussed a lot longer.
Oh, I cannot hear you anymore.
Patricia, something happened with your microphone.
Am I back?
Yeah,
Yeah,
now.
Yes,
now
okay.
it's back.
Thank you. Yeah, so we gathered a lot of barriers and some enablers, but we haven't been able to get to the last question, but there has been a really interesting discussion on the first question. So we discussed, or our participants discussed a little bit on barriers and on different backgrounds, like saying that if you are from different backgrounds, it is very hard to know what the health community is talking about. So there are a lot of wordings that are used that are inaccessible, and the things we do in health promotion are very niche, so that we have to take into account that we need to use a language and wordings and so on, so that it's accessible to everyone, and the information that we give is accessible to everyone. And like even using the wording NCD is kind of inaccessible because a lot of people don't know what it is. And yeah. And also another barrier is missing feedback in youth participation, and also a low level of knowledge about advocacy, like how young people can engage, and sometimes a missing of self-confidence, and the feeling of being scared to talk in front of a lot of people or to express their own concerns. Like sometimes they feel not empowered enough. So when we shift this to enablers, it is important to empower them and to facilitate to look at the long-term changes, because changes take a lot of time, and also to give the youth a chance to start by zero in this process, and to take the chance, and also to give the chance. So from both sides, the youth can take the chance and you give those chances. Also an enabler would be to track the process in order to give feedback all the time, and to train youth delegates. Yeah, so that's basically what I wrote down. If there are any comments from my group, please feel free to comment on this.
Thank you, Patricia. Anna, you wanted to add anything?
No, just says thank you. It was a really, really good everything.
Thank you. I'm happy to hear that. And then moving to our third breakout room, where Cameron was the moderator, and I think Mehitabil will be reporting from that group. I hope you're able to unmute. Otherwise, I would ask. Yep. Okay, perfect.
Yeah. Can you hear me well? Okay.
Yes.
Cool. Yeah. So we had a very good discussion in our group as well. Thanks to Cameron for great moderation. Actually, as the group led by Patricia and Anna, we also noted the lack, or at least like difficult access to information for young people, depending where they are, what are they also their job, and then how they can contribute to the discussion. So definitely, I mean, this is something that we identify as well. Also, it was brought up that in terms, a challenge in terms of how high expectations can be put into working groups sometimes, and the focus in that sense can be either too broad or too narrow, depending on how scalable also the efforts that are put in the agenda are. So that could be a bit intimidating also for young people to contribute and to see the results, as Patricia was saying. And also, I mean, the very fact that we are young sometimes is a barrier in itself. It's of course an advantage. I mean, that's why we're here. But of course, in some fora where senior, presence is very prominent, that could lead to some level of dismissal. So that's something that we perceive and we unfortunately experience when we are invited in some events and some discussions. And so in terms of like enablers, we mentioned, of course, easy access to information for everyone and easy to understand, and that could lead also to better communication and looking into different methods of communication to reach more people, but also to give different way and multiple ways of engaging to young people. And cooperation also was mentioned as key. I mean, efforts like this one are especially important because it's good to specialize in our own conditions and in our own fields. But I mean, really, like unity can do a lot in terms of having our voices heard. So that could really break the barriers there and yeah, make a difference. So I hope I capture everything, but please, Cameron, if I forgot, or anyone else from the group, if I forgot anything, or yeah, please feel free to jump in.
Well, that was great. Thanks so much.
Thank you, Mechitopil and Cameron. And I think there was also another discussion going on here in the main room. Maybe, I don't know, Katya, Lucia, do you have some reflections from what was happening in the main room?
I am happy to start, and then maybe Katya, you can kind of complement. But I think some of the points that were made came up in our discussion as well. But maybe something that hasn't been mentioned yet was this idea of making sure that youth are involved from the very beginning. This kind of was mentioned in one of the presentations, and that it's not kind of an afterthought. And similarly, when these positions are, it's not only about creating these positions of kind of youth representation, but also ensuring that they are actually taken up by young people as well, that you don't have, that you have that kind of true representation. And then with that as well, that youth participation be compensated, that it's not always voluntary. And that kind of comes round to kind of one of the major systemic barriers, which is that often you don't have the full kind of representation of all diverse groups within kind of some of these spaces. So really making sure that that you have that kind of full representation across the kind of youth space. And then, yeah, I mean, maybe Katya, you can come in more on this, but we had an interesting discussion around, funding, which I think probably was raised in a lot of groups, but that you need the funding to generate the evidence, to show the impact of meaningful engagement, and you end up in this kind of catch-22 of sort of not being able to prove it because of a kind of lack of funding, and then the funding doesn't necessarily go towards generating the evidence. And that this remains kind of a bit of a structural barrier there as well. But Katya, maybe you want to add something that I missed.
No, I think you covered it pretty well. But so we kind of explored a couple of things that funding is connected to, everything from institutional support to the way that grants would need to be like slightly more adapted to youth specific context in order for them to be relevant. But it also, we're often stuck in loops where without being able to access funding, there's a lot of things that you can't do, but if you can't do those things, you again cannot access extra funding or more funding. So you're kind of just stuck in a gray zone when it comes to that. So yeah, maybe that was the only thing that I wanted to kind of add, but yeah.
Yeah, also looking at the time, so we don't, so we try to finish as we predicted in 2 minutes. I would just express my gratitude to all of you who took the time to be with us, to contribute to this discussion, and also who will stay ahead with us to also contribute to the joint statement process. And at this point, I would also give Katya the final words to maybe a few concluding thoughts and what is ahead of us in this process.
Thanks, Urška. Thank you to all the panelists as well as to all of the participants for taking part in this session today, as well as for contributing all of your thoughts and inputs. As Urška mentioned before, all of this will feed into the joint statement of our youth chapter, but we also have a pretty big road ahead of us in order to actually create this joint statement, specifically by outlining actions of what can we all do together in order to be able to improve the youth engagement, what we need to be working on in terms of advocacy towards the institutions, towards other youth organizations, how to support each other, and so on. So in the upcoming days, what you will be able to find on the EU Health Policy Platform is a timeline of the plan through which we will create this joint statement. And this will also include a couple of brainstorming sessions that will take place in kind of like Zoom meetings that we will be organizing specifically just for this purpose. And they will be open to all of the members of the youth chapter that want to be engaged. And also, if there are any participants in this call that are not yet members of this chapter, you're welcome to join the Health Policy Platform and join us. If you have anyone in your network that is already a part of it, feel free to ask them about how to access it. And we are also available to you for support. And especially this part is important because I have noted quite a few questions in the chat that was talking about the joint statement and wondering what it will include. Technically, it can include anything that we will be agreeing on as a community together. So this is still the opportune timing for all of us to come together, provide inputs, and co-create a joint statement that will represent our youth chapter going further. Now, I also want to mention that alongside the creation of the joint statement, we will also be building a library of resources at the youth chapter itself. So if you or your organization come across or have also developed any particular materials that you feel would be valuable to the youth community or institutions that are working on youth engagement, you're welcome to upload them onto the EU Health Policy Platform into the chapter itself, and they will become a part of a larger repository of resources. Now, that is it from my side. I will not take much longer, but would just like to end that youth engagement is not necessarily just about, talking and pretty words, but it's actually about walking the talk. It's about action. And I think that's where we need to go next to make sure that the joint statement will be a tool that we can use in order to operationalize youth engagement across Europe. Thank you.
Thank you.
We wish you all a nice rest of the day and hope to see you at the next webinar. Bye.
Thank you. Bye.